By the time you leave hospital, you will be transferring from sitting to standing safely.
Yeah, that's it. Perfect. And you put your arms into your crutches.
You will be walking safely with either crutches or a frame and managing stairs.
Once you've been discharged up to the 6th week, really it's a question of getting strength back in your knee, getting control, making sure that you're safe. And during this time, most people are still using at least 1 or if not 2 crutches. The expectation is that you'll be going to the shops, you'll be enjoying yourself. That's not really the case for the first 6 weeks. It's all about getting the knee moving, getting some function going.
The occupational therapy team will help you to review the plans that you have already made for your first few weeks at home after your discharge from hospital.
We look at the patient's setup at home and to make sure that they're going to manage safely once they're back there. So looking at who can do their food shopping for them, looking at the housework, all those tasks that they're going to be advised to avoid.
The occupational therapy team will be available to answer your questions while you're in hospital and at our post-operative clinic after you return home following your operation. You can practice activities at the assessment flat at the hospital so that when you are discharged, you are comfortable doing everything that you need to do in your everyday life. By the time you leave hospital, you will have a good understanding of the home exercise programme that you began learning at knee school.
Everybody progresses at a different rate, and we adapt and adjust your exercises and your rate of recovery to do that. Some patients are comfortable enough to get out of here days 2, day 3. Some patients it can take a little bit longer than that. We will make sure that you're progressed at a speed that's comfortable to you, so that you're using the walking aids that are appropriate to you and doing the exercises that are appropriate to you as well.
It is essential to keep practicing these exercises at home every day. You will have a series of weekly goals that are set by the hospital. These are designed to assist your recovery and provide a safe and gradual return to everyday activities. Before you leave, you will have an X-ray of your knee. On discharge, the nurses will give you the appropriate medication, a letter for your GP, a sick certificate if required, a physiotherapy appointment, written instructions regarding care for your wound and further appointments. Some discomfort and swelling around your knee are normal following surgery.
It's had a big operation and it will be sore for anything from 10 days to 6 weeks. The average is 2 to 3 weeks that it's uncomfortable, and shortly after 2 or 3 weeks it usually improves. The scar itself can be a little itchy and can be irritating. Again, that is usually completely settled within a month to 6 weeks.
If you have any concerns about your wound, you should contact the team at the hospital rather than seeing your GP. You may not be able to drive for a few weeks following your operation. 2 weeks after your discharge, you will have a wound check at the knee school. If you need it, extra physio may be available. You may also have outpatients appointments at 3 months, 1 year, 5 years and onwards to allow your progress to be monitored.
Care of the wound is important after knee replacement. Some surgeons will use little clips to hold the skin together, and they'll be taken out at about 10 days. Some surgeons will use a dissolving stitch under the skin. Either way, the wound should be healed within 1 to 2 weeks, and at that stage patients will be able to shower, bath as necessary. The wound will look slightly red initially, and that's nothing to be alarmed about. But if there are any concerns about the wound, we would prefer it if the patients actually let us know, because it's useful for us to be able to see the wound, and we can either reassure them that that is a normal looking wound considering the surgery they've had, or whether if we worry that perhaps they may have a superficial infection in the skin which will require antibiotics.
Every patient's progress is different and they'll progress at their own pace, but as a general rule, the more work you do with your physiotherapist and on your own at home to strengthen the knee and to do your exercises, you'll progress more quickly into your everyday activities, and all patients will be followed up at 6 weeks in the joint review clinic, and any specific problems will be dealt with there.
When you are at home, it is essential that you follow the advice of the physiotherapists in order to make the recovery process as effective as possible. Make sure you have friends and family in place who can transport you, shop, clean and even cook for you. Here's a list of important do's and don'ts that will help you progress for the first 6 weeks after your operation. Continue to take pain medication if needed. Do the exercises as instructed by your physiotherapist. Try and take regular walks. Keep your wound clean and dry. Take a rest on your bed for at least an hour a day. Rest on your bed for short periods with your feet above horizontal. Do contact the knee school if there are any problems with the wound or if you have an increased pain in your calf associated with swelling. Don't sit for long, you may become stiff and find it difficult getting up and going again. Don't drive unless you have been seen and assessed in the knee clinic. Don't stand still for too long. Don't put a pillow under your knee. Be sensible and don't overdo it. Less can be more in the first 6 weeks. It is a gradual process. It will take at least 12 weeks for your knee to feel like a knee, and it will go on improving for 18 months.
The truth, when it came to it, is that it required a lot of hard work. It wasn't as easy as I thought perhaps it was going to be.
Each day has been better, and now I feel that I don't even feel as though I've had a knee replacement. It's absolutely wonderful. Now and again it does a little click.
I think my husband was quite surprised at how quickly I got about. I think he was expecting to be nursemaid for a lot longer.
Gardening I do find very difficult because I cannot kneel, I have to bend forward, so that hurts my back. So yeah, the quality of life is not terribly good.
I have to say at first that the main thing after the pain was the heaviness in the knee. And I thought I'm going to be walking about here thinking, oh, this is heavy. But then after a couple of months, I suppose, the realisation just went, and I don't even think about it now.
Everybody's different, aren't they? And I know 3 people, friends of mine, have had it done, and they are it worked fantastically. Unfortunately, I'm obviously one of these few people it hasn't worked for.
Each day you tackle a different task, and soon you're really laughing. I mean, now I'm on and off the buses, around the shops, you know, can't keep me in.